Hello everyone, we are live. I welcome you all to today's live stream where I will be talking about how you can prevent the knee osteoarthritis or arthritic knee pain. If you are new here and if you don't know me yet and haven't met me personally, my name is Ishan Arora from PriMovers, which is an online pain and performance rehab platform. I'm a physical therapist and I have been helping people with aches and pains and injury prevention now for more than 12 years using simple exercise home rehab routine on a regular basis. And if you're new here, consider turning on the live stream notification so that every time we go live you get notified. Also, let me know whether you're watching this on live or watching it on replay in the comment box below. Also, if you could let me know where you're tuning in from so that we get to know each other, that'll be great. So let's get started with today's topic, which is how you can prevent the knee osteoarthritis. Before we dive into how you can prevent the knee osteoarthritis, let's first understand what are the structures involved in knee which undergo wear and tear and damage in the case of knee osteoarthritis. So let's get started. Also, let me know whether if you are someone who is already experiencing any knee pain or discomfort or already have the knee osteoarthritis, or are you someone who's not having any knee pain or discomfort but would like to prevent the knee pain or dysfunction on a long run. Then let me know in the comment box below what describes you best. Are you someone who's already experiencing the knee pain, or are you someone who's looking for the knee pain prevention so that you can stay pain-free for long term without having any knee osteoarthritis or any discomfort? So let me know in the comment box below. So as I mentioned, let's first understand what are the structures that undergo damage and wear and tear in case of osteoarthritis. In order to understand that, we need to understand what are the structures involved in the knee. So I will get started first with the areas that are most commonly involved in the knee osteoarthritis. So as you can see here, this is the area, this bone is particularly known as femur or the thigh bone. Now we have the shin bone here, which is called tibia. This forms the second portion of your knee joint. The third bone which forms the knee joint is called the kneecap or the patella right here. This is the small bone in front of the knee which forms the knee joint. These three bones combine with each other to form a knee joint. There are various other structures that are there in the knee that undergo wear and tear in case of knee osteoarthritis. So if you can see here, so these are the ligaments on the inner side of the knee known as the medial collateral ligament. And also if you see the structure here, very prominent structure which is slippery structure right here, that forms the cushion in the lower part of the knee bone, basically the thigh bone, and in the upper part of the leg bone, as we can see here. So we have some cartilages here. We have one very important cartilage in the knee which is wedge shape called the meniscus right here. As you can see, the pink color wedge shape structure is called meniscus. Now the function of these cartilages right here and these one is they act as a cushion in the knee. So whatever compressive forces that come in the knee, they take care of that. They make sure that your knees are not, so basically the bones that are there in the knee, they are not rubbing against each other. So they're acting as a cushion. So we have, as we know, we have a patella, the small bone right in front, and we have cartilage behind that kneecap as well. And all these cartilages just make sure that they act as a cushion. They don't let the bones to bones rub against each other. The pink structure that you see here, which is called meniscus, act as a shock absorber. So your knee undergo various stress and load, which is compressive and tensile forces in the knee. This pink structure, which is the wedge-shaped meniscus, they help as a shock absorber. They won't let the shock come much around the knee area. Now as you can see here, so this is the x-ray of the normal human being, and we can just visualize how does your knee look in the x-rays. So again, we have the thigh bone here and we have the leg bone here. They are basically making the joint which is called the knee joint. So we have the kneecap which is marked with a line here. So this is the kneecap here. Again, so we have the covering on all the bones here, which is the cartilage covering, and this again making sure that the bones are not rubbing against each other and not causing any damage to the bone. So as we can see here in the normal x-rays, so we have a lot of gap in the knee joint surface, and this joint surface basically has a space for the wedge-shaped structure which is called meniscus here, which are acting as a shock absorber in the knee. Now here we can see how does your knee look like when you have knee osteoarthritis. Before we dive into what really happens in terms of damage in the knee, so let's understand what are the symptoms you tend to feel when you have the knee osteoarthritis. The first thing that you tend to feel when you have undergoing the knee osteoarthritis is you tend to feel the pain, tenderness around the joint lining, inner side or the outer side joint lining. You feel the pain, tenderness, swelling, warmth around the knee. And why exactly it's happening? This osteoarthritis is a result of the wear and tear happening in the knee as a result of the degenerative process that is happening in the knee with the age. So degenerative process usually happens with the age, but sometimes it tends to happen faster for people who involve in high sporting activities, also people who has been sedentary and have a real deconditioning of the muscles. I'll come to that part a little later, but let's first understand what is happening in this knee in case of osteoarthritis. As I mentioned, so the symptoms that we tend to feel is the pain, tenderness, swelling, warmth in the knee. You usually tend to feel more pain in the morning whenever you're resting or whenever you're sitting for a little longer. You feel your knees getting stiff. Along with that, you tend to see the swelling on top of the knee. You tend to see the swelling in the lower part of the knee, inner side of the knee. Along with that, again, I'll come to this part. We tend to have wear and tear in the knee, especially in the cartilages, which I showed you earlier. So the cushions of the knee, which are the cartilage which were trying to protect bones rub against each other, they usually undergo wear and tear because of this degenerative process happening in the knee. And as a result of this degeneration, you can see like this is behind the patella, which is the kneecap, the wear and tear is happening in the cartilage. The cartilage are undergoing fragmentation, so they become fragments, undergo fray, and which results in basically the small loose fragments which come into the joint surface. When this joint, basically the loose fragments start coming to the joint surface, they start causing the pain, tenderness, swelling because they are restricting the joint motion, and sometimes they tend to lock your knee joint because the loose fragments of these bodies tend to come between the joint surface, and again as a result of which you tend to feel at times that the knee is getting locked. So again, one of the very serious conditions in that case, because if the knee gets locked, we tend to have more pain, more discomfort. Along with that, what we tend to hear is whenever you bend and extend the knee, you tend to feel the crepitation sound, the creaking sound from the knee. The reason for that is again those loose fragments that are coming between the joint surface. They are not letting the knee joint move freely and making the sound. That's why you get to hear that. Now we will come to the root cause why exactly this arthritic changes happens in the knee. So one thing that I told you is knee undergo wear and tear and degeneration because of the age. So as we age up, especially above the age of 45-50, we start to have the knee arthritic changes start to build up, okay, which results in all this wear and tear in the cartilage. Now if you can see, there is a cartilage damage behind the kneecap here, and the lower part of the thigh bone which was there having the cartilage cushion, again having fragmentation of the cartilage here, so the cartilage is undergoing wear and tear. We can see the lower part or the upper part of the thigh, the leg bone or the shin bone is also having some wear and tear in the cartilage, just because of this wear and tear of the cartilage. Now earlier you had a cushion between the knees, so the space between the knee joint was slightly more, but since now this cushion is not there because of wear and tear, the space between the knee joint becomes lesser. That's why whenever you would go to the doctor and he would ask you to get some x-ray or any other imaging investigation done, they would see that and they would tell you that the space between the joint surfaces are getting reduced. The reason for that is the extra layer of cushion that was there as a form of cartilage is not there anymore, or probably undergoing breakdown. And because of that, you see the reduction in the decrease in size or the space between the joint spaces. As soon as you start having the joints rubbing against each other, what we call as, it's called the bone spur, which is an outgrowth of extra bone, starts to happen in the lower part of the leg bone because of, again, the bone to bone friction rub, and in the upper part of the leg bone right here as well, the shin bone. We tend to see some extra outgrowth of bone. This is called the bone spurs. That's why your doctor would tell you, okay, your knee having reduced space in the joint, along with that they would see some extra outgrowth of the bone, which is called the bone spur. And the reason for that is the bones are rubbing against each other. Now the contact is happening between the bones, which was not happening earlier because of the cushion of the cartilage. Now let's visualize the knee, how it looks from the side when you have the knee osteoarthritic changes. As I said, like, we had a cushion behind the kneecap, the small bone right in front here, so we can see the wear and tear happening in the back of the kneecap as well. And again, those loose fragments, understand, those loose fragments now will come between the joint surface and will cause the dysfunction and pain. Again, if you think I'm going fast, do let me know, I'll slow down. Also, let me know if you have any questions related to osteoarthritis. Do let me know in the comment box below. I'll be more than happy to answer your questions. So do let me know in the comment box below. Alright, so again we can see the loss of cartilage here as well in the upper part of this leg bone, and the behind of the thigh bone we can see some wear and tear in the part of the cartilage, as you can see here. Okay, I'll just open the group again just to make sure that I'm all right. Now let's see how your knee looks like. So you go to the doctor, he would examine your knee and would tell you that you have some wear and tear happening in the part of the knee, and basically would show you the wear and tear, especially if if you're getting MRI done, which can visualize your cartilage more than your x-rays. X-rays are usually meant for the bony structural changes, so you can visualize only the bony structural changes in the case of x-rays. And just because you have the pain, tenderness, swelling in the knee, grating sensation, you tend to see the knee in the x-rays like this. You see the reduction in the joint space because the cushion which was there at the cartilage is not there anymore. You tend to see extra outgrowth of bone that you can see here, you can see here as well, you can see here. This is called the bone spurs. Again, the bones are rubbing against each other now, and because of that the extra outgrowth of the bone is happening, which is called the bone spurs, and usually they are painful. So whenever the bone spur happening, that means the bone to bone friction rub has started happening and usually makes your knee joint more painful. Now this is the x-ray of the normal person versus the x-ray of an osteoarthritic knee. So let's see what happens here is, so we can see, like, again you see the good space between the knee joint surface here and the knee joint surface here. So it's a pretty well maintained joint space between the knee joints here, versus if you see the x-ray of a person who's having the osteoarthritis, there is a reduction in the space between the knee joint here. And the reason for that is, again, the cushion of the cartilage is not there anymore, and now the bones are much closer to each other, and as a result you feel that the fragments of the bone coming between the joint surface making the creaking sound, crepitational sound. Along with that, when you would again, if you would have seen some people that when they move the knee, bend and straighten the knee does not move freely. It basically moves in phases. It'll move this much and then this much, and so again it'll move in phases because the bones are rubbing against each other, so there is no cushion there. The lubrication which is there in the joint tends to go down. The reason being the cartilage wear and tear happens. Whenever the cartilage wear and tear happens, the covering of the knee joint, which is called the synovial covering here, starts or undergo breakdown, and usually the rupture of this synovial covering, because of this rupture, the fluid which was there in the knee starts to ooze out from the joint, and it starts coming around the knee joint or below the knee joint or above the knee joint. Now we had the kneecap here, right here, Now this is supposed to be moving up and down. So when you straighten the knee, the kneecap moves up. So the kneecap moves up when you straighten the knee, and when you bend the kneecap moves down. Now what happens in this case is, since there is swelling above the knee and below the kneecap can't move freely, first of all. Secondly, the kneecap which was there at this place, the cartilage which was there behind the kneecap as well, which is the patella, again that also makes the surface of the kneecap very rough, and as a result of which kneecap moves, instead of moving up and down, it starts moving diagonally. As a result, since this is not the natural motion of your kneecap, it starts to have more wear and tear in the cartilage part, which is the back portion of the cartilage, resulting in the pain symptoms and again tenderness, joint swelling, and all the symptoms that I just explained in the osteoarthritis tend to get worse when we have the cartilage wear and tear everywhere in the knee joint. So the symptoms that you tend to feel with osteoarthritis, as I said, is the pain is the first symptom that you tend to feel in case of osteoarthritis, along with the inflammation, which is the tingling, tenderness, warmth. You feel that the area or the knee which is undergoing wear and tear or the osteoarthritis tend to be a little more warmer than the other knee which is normal. And you tend to feel more pain and inflammation in the morning, or whenever you're sitting for a little longer hour or resting. So anytime you go in the static phase where you're not moving the knees much, you start to feel the symptoms are getting worse. The other thing that you tend to see is like you feel the tenderness on the inner and outer knee joint line. So when you would basically palpate or touch the inner or outer joint line, you will tend to feel little more sensitivity or pain on touch when you do that. Secondly, again, those loose fragments of the cartilage which are undergoing wear and tear cause the grating sensation or grating, the crepitational sound in the knee. Along with that, the pain usually causes the instability of the knee. So because of pain, now when you start walking, you're not very comfortable. You feel like as if your knee is going to buckle. You feel as if your knee is going to give away. So you don't feel stable. You feel very unstable when you walk. And as a result of which, you usually tend to have the bad gait, the walking pattern. When you have the osteoarthritis, you usually start going on the side, which is called the waddling gait, because of the osteoarthritis. Again, those loose fragments of the cartilage usually results in locking. So at times you would be walking and you would feel as if you bend the knee, but you're not able to straighten the knee, or like you feel like you're not able to move the knee or bend the knee. So either if you are in the bent position, sometimes you're not able to straighten the knee, or if you're in the straightened position, not able to bend the knee. So lock happens, and when this happens, it is very, very painful. Now let's understand, how do we get there? What exactly happens in the body in the case of osteoarthritis? Now, as I mentioned, the osteoarthritis is a degenerative process. It's happening because of the wear and tear happening in the part of the spine. It's happening because of the wear and tear happening in the knee joint as we grow older, as we age. But what happens here is some people tend to have this degeneration coming faster. Either they are sedentary, they are not using or utilizing the muscles well. So the muscles, which are the primary helpers for the joint, and they basically offload the pressure from the joints. And if you are someone who's sedentary, not using the muscles well, definitely the chances of having the osteoarthritic knee will be much faster in your case if you are someone who's sedentary. Secondly, if you are someone who's into the high sporting activities, intense sporting activities, but you're not recovering enough. What I mean by that is you're basically in a very intense sport, but what happens is you don't do the warm-up, you don't do the cool down, or you don't do the recovery, and as a result of which your knee joint tends to have more pressure, more compressive forces compared to the other people, and resulting in more wear and tear which is happening in the knee. Versus if you are in the high sporting activities, but if you recover well, then your chances of getting the knee osteoarthritis or the wear and tear in the cartilage are much lesser. But there are other people who would have there is a certain population who tend to have osteoarthritis or the pain associated with osteoarthritis. Now 90 to 95% of the population usually have something called as overpronating feet. So either they would have feet going inside quite a lot, so when they would walk, I'll just show you. So some people would have called the, just one second. So some people would have overpronating feet, so they would have the feet going inside. What I mean by that is, as we grow, as we age, so there are certain muscles in the feet which are called the feet intrinsic muscles. Most of the people are not aware that they need to be strengthened as well. So you need to strengthen and you need to work on them apart from just walking. Okay, now as a result of which, since you're not strengthening those intrinsic feet muscles, you tend to have the weaker arch muscle, which is stabilized by those muscles in the feet. So if you would have seen your foot has the inner arch and the outer arch. Okay, usually the inner arch of the foot tends to fall inside because the muscle which control that are weaker. We are not really working on them, and that kind of foot motion is called overpronation. Again, 90 to 95% of the population usually fall into that category where they have some imbalance in the feet. Now what it does is basically, as soon as your foot going inside, you would see the forefoot, so your midfoot goes inside, the forefoot goes out. You would have seen that your the forefeet are basically moving out, okay, in this case. And as the foot is going inside, we tend to see that the leg bone moves inside. Okay, so earlier when the leg bone was straight, it's now turning inside. As we have the leg turning inside, the thigh bones also starts rolling inside. Now as we can see, everything is moving just because the foot is not stable. The foot is rolling inside, and what it does is basically it starts creating a lot of pressure on the knee. So the kneecap, which was supposed to be moving up and down, now it'll follow the motion, or it'll follow the pattern the way the leg bone and the thigh bone is moving. The thigh bone is moving inside, so your kneecap starts following this motion. It's a diagonal motion where the kneecap is kind of moving inside more. As we get this motion of the kneecap, we tend to have more wear and tear behind the knee joint, basically behind this kneecap cartilage. And when this kneecap cartilage starts wearing off, again those loose fragments will come into the knee joint and will start bothering you. Along with that, the function of this kneecap is very important. We have 4 muscles in the front thigh. Okay, this kneecap is also called the anatomical pulley. What I mean by that is, the 4 muscles in the front thigh that we have, all the muscle get the equal work or equal strength because of this small kneecap here. If it is moving up and down, all the 4 muscle groups in the front thigh, 4 muscles in the front thigh usually tend to get equal work. But the Suda starts moving more diagonally, in this case inside, it starts to favor more the inner group of muscles. In this case, the outer front thigh muscle starts to become weaker versus the inner front thigh muscle starts to get stronger. There are other things which tend to happen when we have the foot going inside. We have the thigh bone going inside, but the pelvis, the hip bone starts moving out because it basically does not follow the same motion. It starts moving out. Now as you can see in this picture, is the pelvis which is moving out is also straining the lower back here, or called the sacroiliac joint. Now you can understand again, so when we have the foot going inside, which is this, so this is the normal pattern with 90-95% of the population. They would have some dysfunction, or some basically the motion dysfunction in the feet, which is causing a lot more pressure in the knee and also the pressure in the hip. That's why we need to understand why do we get the knee pain in the case of osteoarthritis. And some people tend to get faster. It's not only the age, it's because of the deconditioning of the muscle. They're not strengthening some muscle groups, and they have some limited motion in certain areas of the body. So here we have the foot going inside, which is called the overpronation, which is causing various other dysfunctions or disturbed motion, basically in the legs, thigh and hip, resulting in the pain in different parts of the body. Okay, so we have other condition where the foot is now moving out. This is called the high arch feet. Some people will tend to have a little more higher arch in the inner side of the feet. Now what it does is, it starts to, again the foot is going out, this starts to move the leg outside now, and the thigh bone is moving out. Now the kneecap again, which was responsible for distributing equal force in all the front thigh muscles, is not doing a good job. And since it's moving diagonally here, again the kneecap, the cartilage behind the kneecap will start wearing off faster, and as a result of which some muscle groups which are favored because of this movement of the kneecap will tend to be more active and tighter, versus the inner side muscles here will tend to be weaker. Again, if you see all this small changes in the foot position, in the leg movement, hip movement, is disturbing the knee and resulting in wear and tear of the knee cartilage, and which also is a reason for osteoarthritis. If we get this really well, then we can start working on these imbalances much faster, and we can start preventing the aches and pain associated with the knee. Again, let me know in the comment box below if you have any questions. All right, so I'll move to the next part. Now, what are the muscle groups which are basically undergo wear and tear and undergo weakness? We need to understand why are we getting the osteoarthritis. If we understand the root cause of osteoarthritis, it becomes super easy for us to fix the knee pain associated with osteoarthritis. And once we start working on the imbalances faster, again you can prevent the knee osteoarthritis for the longest time. So it's not basically that everyone I see at the age of 70, 80 will have the knee pain. No, some people will not have the knee pain at all. The reason for that is probably thanks to their active lifestyle, thanks to whatever they have been doing that has been helping them out in taking care of the right balance of muscles around the hip knee area, which are usually the root cause of imbalances and pain in case of knee osteoarthritis. So my point here today is, yes, it's a degenerative process. It can happen to anyone, but again, we can prevent it, we can avoid it, provided you start working on the right things at the right time. And the moment you do that, you can fix the knee pain, you can fix the imbalances caused by knee osteoarthritis. All right. So the usual muscle weakness that we tend to see in case of knee osteoarthritis is the inner front thigh muscle, which is very important muscle, usually tend to be weaker for people with osteoarthritis. And again, when we have the kneecap which is moving slightly outwards, so all these muscles on the outer side are being favored, and they tend to be more active, more stronger, tend to be tight, which results in weakness of the inner ones. Now if it happens, again the chances are you will start developing the knee pain, because this is one of the very important muscle in controlling the load on the knee, and one of the muscle which helps you straighten the knee completely. If this muscle is not working, you will not be able to straighten the knee. Now let's understand, if you are walking and you're not able to straighten the knee properly, and if you're not able to straighten the knee properly, that means you're walking with slightly knee bent all the time. Now let's, again, with the knee bent, the pressure in the knee cartilages and the meniscus and all the supporting structures are much more than when you're able to straighten the knee. So this becomes the primary important muscle to be strengthened or to get stronger at, if you would like to prevent the knee pain or knee injury, especially in the case of osteoarthritis. The other muscle that is very important here is, this is how we basically prevent the knee injury in case of osteoarthritis or the damage in the cartilage in osteoarthritis, and this is how we treat it. So you need to strengthen the other weak muscle, which is called the gluteus maximus muscle here, and the gluteus medius and minimus muscle. These are the very important muscles in the hip, usually undergo for weakness, and when they are weak, they are very powerful muscles. They can offload almost good amount of load in the knee. But if these muscles are weak for you, definitely the pressure that goes to the knee almost becomes 5 to 10 times more. So let's understand, these muscles, if they do the right job, they can fix or reduce or prevent the knee pain completely. But if they are weak, they can increase the load to the knee almost by 5 to 10 times more. So once you start working on it, again, you are on the good side. You will make sure that the knee osteoarthritis is not happening. Now, what are the muscles usually we tend to see are very tight and hyperactive in case of knee osteoarthritis? Again, if you see, this is the outer quadriceps. So I told you there are 4 muscles in the front thigh. The inner front thigh muscle usually tend to be weaker in osteoarthritis, and outer front thigh muscle, which is called the like outer quadriceps, there are the different names for it, but again they tend to be very active and very tight. Again, the idea is, how are we going to get the balance? If we reduce the tension on the muscles which are hyperactive or very tight, if you start releasing them, or if you start reducing the pressure on them and work on the muscle which are weaker, and if you start working on the strength of them, you actually make them normal. You basically come at the same level, and that results in reducing the pain in the knee, inflammation in the knee, and all the wear and tear that is happening in the knee can be reduced. Now coming to the question, can you fix, or can you basically resolve the cartilage damage which has already happened in the knee? The answer is no. You cannot reverse the cartilage damage. You can't repair it. Unless you go for the surgery, you can't repair it. But what you can do is you can prevent the future damage, the further damage of the cartilages. And if you put a halt there are higher chances that the pressure, the pain that comes to the knee will not be more, and you can basically prevent invasive procedures like surgery in case of osteoarthritis. And if you want to fix that, it's important you work on the things that I'm just mentioning here. Now, other thing that usually gets tighter here is the IT band and TFL. These are the muscle groups usually tend to be more tighter for people who are building up the osteoarthritis or have any imbalance which is happening at the level of foot, leg, thigh, hip. If there is any imbalance here, again, either the joint is not moving well, or the muscles are not flexible enough, or you don't have a right amount of stability in the knee, or if you don't have the right strength in the muscles around the hip and knee, you tend to feel that again all the structures are usually very tight. Another muscle which is called the piriformis is the deep buttock muscle, usually is very tight for people with osteoarthritis. Again, the function of this muscle is to rotate the hip out. Again, if it is tight, it usually keeps the hip out more, so you're walking with your knee pointed outwards most of the time, and that starts to cause more pressure on the inner side of the knee, and as a result the inner side of the knee cartilage tends to be like they start wearing off faster than the outer side cartilage of the knee. So again, it's important to understand what this imbalance is, because if you know this imbalance is, and if you start working on it, you can prevent the knee injuries and pain for long term. How do we diagnose really whether someone is building up the osteoarthritis or not? It's simple. Again, you do some clinical test. So you would when we do the clinical test, we basically make you do some certain activities like squatting, or basically bending and straightening the knee, looking for the warmth in the knee, the amount of pain. We palpate the areas in the knee and look for the tenderness. And also we get to know the crepitational sound, which is like the amount of cartilage damage which has already happened in the knee. We tend to see or feel it when you move the joint. That we can do it in the clinical setting also. If you see your doctor or physio in person, you can get that done, or in our virtual system here at PriMovers, like it's an online platform, we virtually examine you and we tell you, okay, now looking at the symptoms and looking at basically the activities you're performing, we can rule out what is the amount of damage in the knee, and based on that we need to find out how we can fix your knee pain conservatively. There are other things that you can do to rule out the knee osteoarthritis, and these are the imaging investigations. You would have seen your doctors must have told you to get this done, either the X-ray or MRI or CT scan. X-ray usually see what's happening or what changes are happening in the bone. MRI is usually seeing what are the changes happening in the soft tissues. In the soft tissues are cartilages and your meniscus and the ligaments. All these changes are usually seen in MRI, and CT scan, again, it's a 3-dimensional X-ray, usually help us in visualizing the bony structures in the knee. So that's how we can basically figure out what's really happening in the knee, how bad your knees are really. How you can prevent really is, as I mentioned, you need to start with the early diagnosis. So you need to be more aware that if you are experiencing something in the knee, the first and the foremost thing that you must do is like get yourself examined by your healthcare professional, so that they rule out what exactly the root cause of the disturbed movements happening in the basically around the knee area. Either your ankle joint is not moving well, or the muscles around the knee are not strong enough, or basically, like, again, you have some different angles with which your knee is taking the load. So we need to figure out all these things to see what exactly happening in the knee. So that is very important. So again, early diagnosis with the clinical assessment is important. The second thing is, once you find out that, okay, now this is what going wrong in the knee, you need to start working on the weak links in your body faster. So again, if you know that, okay, these are basically the things which are affecting me, and you should start working on it without causing further delay, because the more you delay, the more you get it worse. You may not be feeling the pain much at the moment, fair enough, but what happens is, if you keep ignoring your pain and you keep feeling or keep thinking that, okay, I would start working on it once it's kind of really bad, then sometimes it becomes too late to be fixed with the conservative part. And conservative means like you are fixing the pain without going any basically invasive surgery or procedure. So it's important that you start early and you start working on your weak links. The third thing is method to check the improvement. Again, now you know now what's happening wrong in the knee and around the knee. Either the ankle is not moving well, hip is not moving well, or the muscles are not stronger. Once you find out, you need to start working on the program, which is the conservative program. At PriMovers, we usually give like the exercise program in the app, so that you have there's a reporting system, and you're doing your exercises regularly, and with that you keep getting your knees stronger, and or basically areas around the knees stronger. And what it does is, basically it starts building you up, so that you're not basically causing further damage or further injuries in the knee. Along with that, there has to be some system with which you get to know what's the progress happening in the knee. Are you progressing? Either the pain level of the knee pain has come down or not, or has the frequency of pain has changed or not. Earlier you used to pain all the time throughout the day. Now are you feeling the pain coming slightly down, where you feel only the pain in certain hours of the day, not every time, all 24/7. So again, you need to see, is it improving or not with whatever program you're following. Sometimes you would get the program online on YouTube or wherever, and you pick it up, you start doing it, keep doing it, but you, without realizing that, either you're not feeling good with that. Secondly, even if you're feeling good, you feel good only for a few days, but again, it does not fix the problem completely. Again, these are the parameters that you need to keep in check before you start any program. It should not be like you pick up anything and you start doing it, not feeling better also, but you continue doing it, or you stop like randomly and you start doing it everything again. So again, just have some procedure, have some system with which you're working in correcting the imbalances and the pain weak links in the body. Because if you're not working that way, the chances are you're not fixing it for the long term. You're basically looking for the short term approach to pain, and you're trying to somehow do something to feel good, but again, not looking for the long term approach, and again, doesn't help you for the long run. So the basic things that I usually recommend is, if you are someone who does not have the knee pain at the moment, or if you are someone who's feeling the minor niggle in the knee, now these are the things that you should always keep in mind. The first and the foremost thing is, before you start working on anything, you need to make sure that all the joints around the knee have the right amount of mobility. What I mean by that mobility is, your joint motions are well preserved, it's full range of motion. People tend to get confused with the mobility and the flexibility. So when I would use the term mobility, they would start showing me the stretches. They would do, okay, I'm doing this stretch, that stretch. That's not correct. Mobility is how much you're mobilizing, how much you're moving the joint. If you move the joint well to the full range of motion, again, when you see that the muscles are getting less tighter for you in that case. Secondly, you tend to have less pressure, less compressive forces in the knee. Also you would have seen people stretching quite a lot. They would tell you, okay, now I have been stretching some muscles, but I don't see the improvement in that. The reason for that is, like, they are just stretching the muscles without realizing the joints are not mobile enough. So the joints does not have the full range of motion, and the moment you have that, no matter how much you stretch the muscle doesn't get lengthened. You feel that the muscles are tight all the time. Secondly, the flexibility of the muscles. Again, the flexibility is where you gain the range in the length of the muscles. So you need to stretch the muscles optimally so that you have decent length in the muscles. If the muscles are tight, again the pressure or the impact on the load is a lot more. So make sure that once the mobility of the joint around the knee is good, like in the hip, ankle, lower down, and in the knee, if the mobility is going, flexibility of the muscles, the front thigh muscles, the back thigh muscles, the calf muscles, the front hip muscles, the buttock muscles, if they have the right amount of flexibility, again the pressure that goes to the knee is also much lesser. So we don't have to just keep thinking about the pain around the knee. So we can't just keep treating the knee all the time. We have to see the structures above and below, and once you start working on the structures above and below, the pressure that you reduce around the knee is quite a lot. So basically, once you start working on the structures above and below, you realize the pressure that goes to the knee also is minimized to greater extent. Very, very important that you work on the structures above and below as well to feel comfortable around the knee. The third thing is improve the stability of the joints, especially here the knee. You need to improve the stability of the joint. So when you walk, if your muscles are strong and if they are stable, the ligaments are held properly, they are strong, you feel that your knee is not buckling, you feel that every step of yours, or when you're planting your foot properly, you have stability in the knee, and you feel like you're not going to buckle, you're not going to have the joint give away. So the chances of fall, a chance of having the jerk in the knee becomes much less. And this is the third component, and this is all you can do it with exercises. So again, when I'm talking about all these components, I'm talking about the exercise. So exercise to improve the mobility, exercise to improve the flexibility, exercise to improve the stability. And the last part is exercises to improve the muscle endurance and muscle strength. So when I use the term muscle endurance, I'm talking about like for how long you can do a particular task, but without, so basically the load has to be low and the number of times you can do. So for example, if I ask you is you have to straighten your knee when you're sitting number of times, so like 50 times. So I'm talking about the endurance. I'm asking you to do a certain thing for number of times, but the load here is very less, which is just the weight of the leg. Versus if I put 5 kg in at the ankle and I ask you, okay, lift this only 5 to 10 times. There I'm talking about the strength. I'm increasing the load. I'm increasing the load on the leg or on the muscle, and I'm making you do only for few times, and that is called the strengthening in the muscle. So these are basically the way, the sequence with which you should start working on your knee joint to improve the discomfort that is happening in the knee. In the case of osteoarthritis, again, even for people who doesn't have the osteoarthritis right now, or maybe have the minor niggle or does not have any discomfort whatsoever, again, this is the sequence you should follow to prevent the injuries to any part of the knee or any area of the body. If you follow this sequence, there are higher chances that you'll never get the injuries anywhere in the body. Okay, so very important. So I highly recommend this structure of working on the body.